And as we work to get our nation vaccinated, we have to also acknowledge this is a global fight and do our part to lead on the world stage. The deadly outbreak in India is a heartbreaking reminder of what can happen when this virus spreads unchecked, when it mutates into more contagious, more deadly strains, and when it overwhelms healthcare systems. It's a reminder this pandemic won't fully be over for our country until it is over for the world.
We are planning, and I underscore the word planning, to have booster doses available, if necessary, for the American people. Increased age, the natural waning of antibodies over time, and new variants all increase the probability that booster doses may be needed.
Dr. Fauci, we don't know whether the pandemic started in a lab in Wuhan or evolved naturally, but we should want to know. 3 million people have died from this pandemic, and that should cause us to explore all possibilities. Instead, government authorities, self-interested in continuing gain-of-function research, say there's nothing to see here. Gain-of-function research, as you know, is juicing up naturally occurring animal viruses to infect humans. To arrive at the truth, the U.S. government should admit that the Wuhan Virology Institute was experimenting to enhance the coronavirus's ability to infect humans. Dr. Fauci, do you still support funding of the NIH funding of the lab in Wuhan?
Senator Paul, with all due respect, you are entirely and completely incorrect that the NIH has not ever and does not now fund gain-of-function research in the Wuhan Institute of Virology.
Do they fund Dr. Barrick?
We do not fund.
Do you fund Dr. Barrick's gain-of-function research?
Dr. Barrett does not doing gain-of-function research, and if it is, it's according to the guidelines, and it is being conducted in North Carolina.
Will you, in front of this group, categorically say that the COVID-19 could not have occurred through serial passage in a laboratory?
I do not have any accounting of what the Chinese may have done, and I'm fully in favor of any further investigation of what went on in China. However, I will repeat again, the NIH and NIAID categorically has not funded gain-of-function research to be conducted in the Wuhan Institute.
Dr. Walensky, I used to have the utmost respect for the guidance from the CDC. I always considered the CDC to be the gold standard. I don't anymore. So here we have unnecessary barriers to reopening schools, exaggerating the risks of outdoor transmission, and unworkable restrictions on summer camps. Why does this matter? It matters because it undermines public confidence in your recommendations, in the recommendations that do make sense, in the recommendations that Americans should be following.
I have a 16-year-old. Every year he comes home from camp and he writes the number of days until he returns to camp the next year. This year, it got to 0, and I told him he wasn't going. I want our kids back in camp. We now have 38,000 new infections on average per day. Last May 11th, it was 24,000, and we sent a lot of kids home and camps were closed. The camp guidance is intended to get our kids to camp and allow them to stay there. Thank you.